I'm the chair of the Medical Advisory Board of the Global Health Institute. We need coordination with different kinds of practitioners within the healthcare paradigm to help us really bring to the patient a team of people that can advance that person's well-being.
I trained at the University of Pennsylvania at Manhattan Eye, Ear and Throat Hospital, and I'm on faculty at Weill Cornell Medical Center. There is so much about healthcare and disease that we don't understand. It is so critical that we extract as much therapeutic benefit from all fields of endeavor as we possibly can. And that's what integrative medicine actually is all about.
I began to look, perhaps almost 40 years ago, at therapies that might hold out some hope for conditions where Western medicine wasn't terribly helpful.
In the 1980s, I was invited to study with a professor at Princeton University to study meditation and different mind-body techniques. I found that it was remarkable and had applications and ways to benefit health that were unbelievable, and that set me off on the path.
The Global Health Institute is premised on the idea that we can bring scientific method to studying some of these approaches to healing. This is a very important mission. This is what I've pushed for at the NIH, at the NIMH. It's what I feel is crucially important now.
Within the lung specialty, I saw a lot of smokers, and I felt my duty was to help them stop smoking. And so I learned acupuncture to use it for smoking cessation.
When I was a young man, I discovered by sheer accident that there were analgesic properties in green bell peppers and decided that I would pursue that as a research interest.
Mind-body medicine says and is demonstrating that we have the capacity to make very profound changes in the way we think and feel and in the way our body functions.
I've reviewed the work of J.P. Farrell and have actually been present where participants in observational studies have had work done.
In 1978, I was in a car accident that put me in the hospital for 3 years. My lower left leg was smashed.
When I went to the doctors at Columbia or New York Hospital for Special Surgery, it was strictly, well, there's not much that can be done. Their only alternative was amputation.
Hippocrates said, first do no harm. So it always makes sense to begin with those approaches, like mind-body approaches, which are least likely to do harm.
They were talking to me about amputating from here down and being part of a physician's family. Those were the guys that I thought knew what all the options were. I attribute the improvement I've got to the therapy I got. My left leg, which at one time had no calf muscle at all, being able to do this without any pain whatsoever is extraordinary. I can walk normal gait. I'm just getting stronger and stronger in walking.
But there are deeper changes at the level of the tissues as well, so that changes in the soft tissues as well as bony tissue can ensue.
The mind can affect tissue in the body, soft tissue and hard tissue and bone and different things.
I was born with amniotic vein syndrome. In my situation, it was a severe case, so I needed to have surgery. I've had about 30 to 35 surgeries. I would take pictures and look at my nose and look at how I looked in the mirror. And in the beginning, it was really thick and wide.
And there will be untold benefits to society in rehabilitation, treatment of disease, a reduction of inflammation, breakdown of scar tissue.
After he was done, he was like, touch your nose. And I touched it, and I was like, oh my God. I noticed right away that the sides of my nose, it felt a lot closer, because before my nose was a lot more wider. So I definitely felt the difference. It felt smoother. And I was able to tell that something was different here, which was definitely a positive thing for me. I felt a lot more confident, and I noticed that I felt better about myself. I would look in the mirror and I would say, wow, I look a lot better, and it made me feel good inside.
I've seen dramatic change in quality of life We have an opportunity here to apply the principles of science to rigorously study some alternative modalities that will show results.
The research evidence is there. The change in consciousness still needs to happen.
These people are at the cutting edge, and I'm really delighted to be associated with them.
There are so many great ideas out there that are just waiting to be discovered. We cannot close our minds to researching anything that has any reasonable merit to helping mankind treat disease.
And I am humbled to be able to be part of this, to serve the growth and evolution of healthcare.
My mission in life to accomplish science underlying the new medicine.
That most patients don't have the opportunity to hear from a physician or other healthcare professional that these techniques should be part of their care.
This kind of thing will only lead to better prevention, diagnosis, and treatment of my patients.
And I've developed what is significant to me, a calf muscle that before was just a straight line.
I just wish that this could be available for other children and they can be blessed like I was